Hi guys, good morning, good afternoon, good evening, wherever you are in the world joining me for this really important video this morning. Before I start, I'd like to shout out to Papa G. It's his birthday today, so happy birthday. I hope you have a fantastic day. I know that you had a good day with your daughter yesterday, so I hope you can enjoy a relaxing day on your birthday. Well deserved. Okay, we're going to talk about the impact of diet and nutrition on dementia. Now, we hear a lot about it, and anybody who goes to see their doctor is usually given some advice about diet and nutrition, or certainly should be. And many people know that the Western diet isn't the best diet on the planet. However, when it comes to any type of dementia, focusing on diet and nutrition can do two things. One, it can reduce your risk of developing dementia in the first place. So we have to start very young with our diet. However, as somebody mentioned to me yesterday, it doesn't matter when you change your diet. If you have an unhealthy diet, an unhealthy lifestyle, it doesn't matter when you change it. You can change it. It's never too late. So I'm here with Lynn, my practice manager, my beautiful wife, often referred to as my handler, and she's going to ask me a few questions about the impact of diet and nutrition on dementia. So I'm going to ask Lynn to ask me the first question.
Okay, can you tell us what is the MIND diet and how is that different than the Mediterranean diet and the DASH diet? What do all these things mean? Because it's very confusing.
Fantastic question. Thank you for that. Okay, many neurologists specializing in dementia and many dementia specialists, like myself, recommend the MIND diet for patients. And we also recommend it for people who don't yet have dementia, people who may be at a greater risk of developing dementia. So what is it? Well, MIND, M-I-N-D, it stands for Mediterranean dash D-A-S-H intervention for neurodegenerative delay. That's what DASH stands for. And it incorporates the Mediterranean diet, which is often written as MD, and the DASH diet that Lynn alluded to as well, which is the dietary approach to stop hypertension. So the MIND diet combines those together. And of course, the Mediterranean diet is something that we've recommended for years and years. And I'm going to talk to you a little bit in a while about what are the recommended foods and what are the recommended foods to avoid. So there's the distinction between them and how they all work together.
Okay, so in that DASH diet, you mentioned hypertension. So why would hypertension have anything to do with cognitive decline?
Okay, so hypertension is high blood pressure, and high blood pressure is a contributing factor to stroke. Stroke is a contributing factor to developing Alzheimer's disease. So we refer to tiny strokes as TIAs, transient ischemic attacks, and they're tiny little strokes that are like momentary lapses. And if you have one or two TIAs, your brain has something called a cognitive reserve. And your cognitive reserve is a little bit like your fuel tank on your vehicle. When you go into the red, it means you're using your reserve and you need to fill up quick. We have a similar kind of thing in the brain. However, once the cerebral reserve is used up, then it's kind of gone. We can't refuel it. So if we have one or two TIAs, our brain, which is a remarkable organ, will rewire itself to compensate for any damage or any losses caused by that. that tiny stroke. What TIAs are an indication that something's wrong. TIAs will build up and lead to a major cardiovascular disease, cardiovascular attack or stroke. So the TIAs have got to be managed effectively. So that's the link between hypertension, high blood pressure and dementia, especially Alzheimer's disease. So and vascular dementia. And very often vascular dementia and Alzheimer's disease coexist. Okay. So there's the link between that.
Okay, so if someone is already taking high blood pressure medication, would it make sense to also do this MIND diet?
Absolutely. We recommend the MIND diet to everybody. It doesn't matter who you are. We need to be in schools talking to children about the impact that diet and nutrition and lifestyle, I'll talk a little bit about that in a minute, but diet and nutrition, we need to get the younger generation to understand how that impacts on the brain. You know, with young athletes, we talk to them about physical exercise, building muscle. If you're a runner or if you're a footballer or cricket or rugby, you know, a lot of people focus on building muscle. Well, that's great. And we need to have the same mindset about our brain, because our brain is a muscle and it also needs exercise and it also needs looking after. And diet and exercise are the two things that your brain needs to be healthy, to sustain longevity, and to be able to function at your most optimal ability. So there's the link there.
Okay, so you alluded to lifestyle factors. So you talk about eating right, exercising your brain, definitely, because it gets lazy. You have to challenge it. Keeping your blood pressure in a normal range. What else is an important lifestyle factor that a person can control to limit their likelihood of developing dementia?
Okay. One of the biggest things that the Western society experiences is major stress, major anxiety disorder, mood disorder. Where does all that come from? It comes from lifestyle. So your lifestyle needs to be where we're not rushing around like headless chickens 24/7. In the Western world, it's all about what can I get? It's all about materialism. There's a lot of materialism here in the Western world. I need a new car, I need a new house, I need to go on holiday, I need to buy a new boat or a bicycle or whatever it might be. And that seems to be a big focus in the Western world. What about stepping back a little bit and taking time for self? It's really important that we take time for self. We've known for years and years and years the positive benefits of meditation, the positive benefits of yoga, and the positive benefits of physical exercise. And I just read a recent piece of research that was demonstrating that going for a run was equal to the impact that an antidepressant has for people who are living with clinical depression. So exercise is really, really important, extremely important. So those are the things we need to be able to do. We need to manage our stress levels, we need to manage our anxiety levels, we need to manage our mood disorders. And the Western diet is not built to help us with that. One of the worst things to put in our body is processed food, and highly processed food, like eating fast food, fries, French fries, chips. Very, very, very unhealthy because they are highly processed foods. Highly processed foods are very, very damaging, not just to the brain, but to the rest of the body as well. So because we live in modern society in the Western world, and there are so many fast food places to go to, People have had a long day at work, they're going home and they'll go through a drive-through and pick up fast food. Highly processed, highly processed. Now, I'm not saying that we should never do that, because that would be unrealistic. It's okay to do it occasionally. But I really want to encourage people to think about their diet, think about their nutritional intake, think about, reducing the amount of sugar you put into your body. Sugar, although we need a certain amount, if you have a can of soda, you're taking in about 32 tablespoonfuls of sugar. That is, how much sugar do you need in a day? Definitely not that much. So I would encourage people to reduce the amount of soda, and especially people who already have a diagnosis of Alzheimer's disease, vascular dementia, or any other form of dementia, to kick soda to the sidelines and drink other things as well instead, like something with antioxidants in it. It's okay to have coffee. Coffee is good. Coffee is shown in many research to reduce the risks of many neurological and neurocognitive diseases and disorders. So that's the link. So it's lifestyle. It is getting rid of or reducing as much as you can the stress, the anxiety, and the mood disorders through really good diet, nutrition, and exercise.
So can you talk about your training in the UK, how you were part of that study at Last Resort? What is that about? Because I think that's very important, and how they treat things differently versus the US.
Okay, Always a Last Resort was a government initiative back in 2008, 2009, where we looked at the amount of antipsychotic medication that was being prescribed for older people, specifically older people living in nursing homes who had a diagnosis of dementia. We discovered that the contribution of antipsychotic medicines led to an earlier death. So the outcome of that was that our recommendations to all medical providers and prescribers was to think of other interventions and interactions before you think about medication. And also there was we have a recommendation for certain types of antipsychotic medication that is licensed for people with dementia, and that's very few, because there's been research that demonstrates it is a contributor to earlier death. So there's many other things that you can do before you reach for the prescription powder.
Okay, so how do these prescriptions tie into the diet? Are you saying that you found that there's other things that you can do besides prescribing these antipsychotics to people that are having maybe unwanted behavioral issues, problems, things that are giving them trouble? Is there other things they can do related to lifestyle?
Yeah, of course. There's person-centered care and true person-centered care, which we discussed in last week's video. And that is really about engaging with people and valuing people. And we talked last week about the Nightingale model of enriched care that engages people in society and community and maintains their sense of personhood. I think we're talking about a different approach. Whilst diet does have an impact on behaviour, of course, it does have an impact on behaviour. We are talking here about engaging with people and not having people being... Let me just change what I'm thinking there. My thinking here is like a butterfly technique, a butterfly approach. So if you're supporting a number of people in a nursing home or a residential care home or memory care community or assisted living community, The butterfly technique is kind of flitting in and out of that person's life regularly. So every minute or two, saying, "Hi, are you okay? How are you doing?" Smiling at people, acknowledging their existence, acknowledging that people are there, and encouraging them to smile and to be happy and to communicate and to interact and all those kind of things. It's so easy to reach for medication. It's so easy to say, okay, this person's behaviour is such, I need to give medication for that. It's a little bit more challenging to think about, how do I resolve this issue, this challenge? Because an individual who is experiencing behaviour issues and who are living with a neurocognitive disorder or a neurological disorder is a challenge for us, not for them. It's our challenge. What are we doing to enhance that behaviour? Because we do, as caregivers, as medical providers, as relatives, as family members, we do things that trigger the behaviour or enhance the behaviour. So I think we have to tip that upside down and say, okay, what am I doing to make you agitated, frustrated, upset, angry? So it's our role to enter the world of that individual and find out what that issue is and what that challenge is. So I think at some point we'll talk about sundowning syndrome and how we can reduce the risk of sundowning syndrome and how we can work with people who are experiencing that.
Very good. So if you're a care partner, you're a spouse or adult child taking care of your loved one living with dementia, how can you implement the mind diet if there's resistance, if they don't understand maybe what you're trying to do? I'm thinking you're going to say something about involving the whole household.
Right. I think that's a really good suggestion, Lynn, about if I'm expecting one of my patients to follow the mind diet, then it would be fantastic for the whole family to follow that same diet. Now, sometimes due to illness, disease, disability, some people have a different diet. They have a specific diet that they have to adhere to. So sometimes you can't always follow the mind diet or the Mediterranean diet or the DASH diet. However, as much as you possibly can, it's fantastic if everybody does the same thing. And also involve the individual in preparing the meals. You know, sometimes if somebody's living with Alzheimer's disease, for example, sometimes, and especially in care communities, the first they know about the food is when it's presented to them. So being involved in making the food, in preparing it, is a fantastic way of being able to encourage the person to adhere to that specific diet. So that's two ways there. One is involving them in preparing it, and the other is everybody eating the same or similar diet. Together.
And I know we've talked in the past with other families getting out cookbooks or magazines that have food in them. If people have a decreased appetite, if you try to present your loved one with too many questions and choices, it can be overwhelming. It can lead to more difficulty. So that's right. Another way.
Yeah, really important to minimize choice. If you're offering somebody a choice, minimize it. And you know, people experience dementia in different ways, different degrees. People are on different parts of their journey. But if perception is impacted and understanding is impacted, then you've got to use some different types of technique to continue to give the person a choice. Person-centered care is about choice. We must continue to give people choices in whatever way we can. If a person doesn't understand a spoken word, then let's use a cue card. Or vice versa. If the person doesn't understand the cue card, because sometimes your brain will perceive, for example, if I offer Lynn this cup of tea and she is experiencing dementia, and a part of that dementia means that her perception of that is not a cup, but a gun or a knife or something else that may be threatening, then I'm going to get resistance. She might push that away, she might shout, she might scream, she might throw something at me. So we have to understand where the person is, and as I always say, we have to meet that person where they are and go into that world. So that's a really good question. So thank you for asking that.
Okay, great. Another thing that people often talk about, and it's been controversial for many years, are vitamins and supplements that can improve memory and decrease the effects of aging. And, you know, should we be running out to the drugstore or the pharmacy and getting a whole bunch of supplements to aid the foods that we're eating that are better choices and our changes in our lifestyle? Where do vitamins and supplements play a role?
It's a really complicated and complex issue, is this. There are certain supplements that are recommended, and there are certain supplements that we wouldn't touch with a barge pole. You know? So be very, very careful about the supplements that you are taking. Always get advice from a medical provider. Always speak to your doctor about any thoughts you may have about taking supplements. There's an issue where, you know, you take too many supplements and you can overdose on supplements. You can take supplements to a degree where you're damaging your liver, you're damaging your body, your kidneys can't, you know, function, they can't deal with it all. The best source of nutrition comes from the food itself. That is the best thing. If that's not possible, then really think about what it is that I need to be taking. And again, I can't answer the question for everybody, because other people have diseases, disabilities, illnesses where they need a certain medicine, and you have to think about the interactions that medicines have with each other and with supplements. So always speak to your medical provider if you're thinking about taking supplements. There are certain supplements that I recommend to my patients, but I know my patients and I know their health and I know their history and I know what may be good and what may not be good for them. So if we think about things that really focus on the mind diet, then making sure you have plenty of greens, plenty of lean meat, plenty of fish, blueberries, turmeric. Turmeric is a really good anti-inflammatory for your brain. So turmeric is a really good food source to have. Again, if you can take it from the root, if you can eat turmeric root in your food, that's fantastic. If not, then turmeric supplements are a good idea, but make sure you speak to your medical provider first and say, this is what I'm planning on doing, and this is what I'm thinking about taking. So don't just go out there and say, okay, for memory, this works, because there is all this stuff out there on the internet promoting certain supplements for brain health, for improving memory. So always speak to your doctor first and foremost. And I think I would leave it at that. Speak to your doctor, because I always advise my patients. So that's where that needs to go.
Because there is no supplement that's been proven to improve memory.
Right.
It doesn't exist.
Right. It's important that our body has sufficient vitamin B complex. It's important that we have B12. It's important that we have sufficient B12. it's important that our magnesium levels are in a good place. There are a number of people whose magnesium levels are very low, and that's a risk or a contributing factor to hypertension. So your magnesium levels need to be in a good place. So if you have blood tests, that's the most important thing. Your lab results will tell you where all your levels are, and where there's a deficiency, that's where you need to speak to your doctor and say, okay, what do I do about this deficiency here? If I have a deficiency in a certain area from those lab results.
All right. Anything else you would like to add to today's discussion?
I would like to, if you can pass me my list that I forgot to bring with me. It's on my desk. Thank you. I'd like to just tell you what foodstuffs we recommend and what foodstuffs we would recommend you don't take on the MIND diet. So remember, the MIND diet is a combination of the Mediterranean diet and the DASH diet. And so 15 foods I have here, 15 foods that we would recommend you eat. Beans, berries, in particular blueberries. Blueberries are a superfood for the brain, so I would recommend everybody eat a handful of blueberries every day. For me, I will put it in non-fat, no sugar yogurt, or I will put it in oatmeal, and that's a really good way of being able to take your berries. Strawberries as well. Strawberries are very, very good. They're anti-carcinogenic, and any kind of berries are great, but especially blueberries. Extra virgin olive oil. If you're making scrambled eggs and you're using butter, stop it. Stop using butter. Use extra virgin olive oil instead. In the Mediterranean diet, they eat freshly cold pressed virgin olive oil. So make sure you use that for cooking. Fish. Eat fish at least once a week. At least once a week. The more, the merrier. Fish is high in omega-3 fatty acids, and omega-3 fatty acids are really important and essential building blocks for the brain. So fish is very good for you. Salmon is recommended. So that's a good fish. There is a book by Dr. Marwan Sabar, who is a leading neurologist, and he works at Barrow Neurological Institute. And he wrote a book with a very well-known chef in Phoenix called the Alzheimer's Prevention Cookbook. And I would highly recommend that book because there are so many fantastic recipes specifically focusing on the foods that we're talking about. And there's some really good stuff in there. So try and get a copy of that. The Alzheimer's Prevention Cookbook by Marwan Sabar. Okay, green leafy vegetables. Eat as many of them as you can. Nuts, poultry, vegetables, whole grains. And there is a recommendation that you have a glass of red wine each day. Now, more recent research suggests that you have to drink gallons of the stuff for it to have a benefit. However, it will not harm you, and it could enhance certainly your quality of life. If you have a 75ml glass of specific, Cabernet Sauvignon is the grape that is shown to be the best. But a 75ml glass, not a goldfish bowl, okay? And a piece of dark chocolate. Dark chocolate is very good for you as well, okay? The things to avoid or to limit are butter and margarine. Margarine should never be considered for anybody or anything. Even flies won't land on margarine, so stay away from margarine. Butter avoid it if you can. Use virgin olive oil instead. Okay. Cheese, very, very fatty, very high in unhealthy fats. Fried food, fast food, we talked about that earlier. Processed food, stay away from any kind of processed food. It's lethal. Red meats such as beef and pork, minimize it. And I know there's a lot of meat lovers out there. People eat meat regularly. Try and eat lean meat. Focus on the lean meat, the chicken, the fish.
Lean meat.
Lean meat, yeah. Stay away from red meat as much as you possibly can. And sweets. Now, many people have a sweet tooth, myself included, and I have a weakness for specifically chocolate, especially chocolate. I love chocolate, and it's one of my challenges and it's one of my weaknesses, but I try to minimize it as much as I possibly can. And if I do eat it, I try to eat dark chocolate. It doesn't always taste as good as that yummy milk chocolate, but it's better for you, and your brain will say thank you for that, thank you very much. And I've already spoken about sugar. Limit the amount of sugar that you take in. One thing I didn't talk about there was eggs. Eggs are fantastic. Eggs are an amazing source of protein and healthy fats. So unless you're on a strict bodybuilding diet where you can only eat egg whites, which isn't the majority of people, go for the egg, eat the whole egg. And that's really, really good for you. So that's the advice there on the kind of foodstuffs that we recommend you go for and the kind of foodstuffs you reduce as much as possible.
Just one more thing, going back to sugar. What about stevia, monk fruit, Splenda, all these different things? You hear all these studies about all these problems. What kind of sugar? Is diet soda okay versus regular soda? No. Is stevia or Splenda okay in my coffee instead of regular sugar?
Okay. Natural sweetener is okay. Your natural sweetener, like monk fruit and stevia, it's okay. Because you're not using gallons of the stuff, you're not using pounds and pounds of it. Use it for cooking as well. So if you're baking cakes or baking, healthy oatmeal cookies, use stevia or use monk fruit, a natural sweetener. Try and avoid things like Splenda, try and avoid saccharin, try and avoid those kind of things. If those things are offered along with sugar, I would go for sugar. So if you have to have sugar and you're in a situation where there is no natural sweetener, use sugar as opposed to Splenda or saccharin or any of those things. And even better is to try and teach your body to drink without sugar. So if you can avoid using any sugar at all, your body will thank you. Your liver will thank you in particular, and your brain especially will say thank you. And you can train your body to do this. You can train your body to enjoy those foods that you've always thought, ugh, can't eat that. Salmon, for me, I've never enjoyed salmon, never liked it. However, if you get Marwan Sabar's cookbook and look at those salmon recipes, I can eat those. If you make it like they recommend, it's great, it's fantastic. And there is certain fish that is really good. The fish that doesn't taste like the sea, because that's what discourages a lot of people who aren't fish lovers. It's like, tastes like the sea. So go for the fish that doesn't taste like the sea.
And no diet soda either.
Diet soda is as detrimental and damaging as non-diet soda. Get off the soda. If the one message today is get off the soda, don't drink it. Drink tea.
Green tea.
Green tea is fantastic. Any kind of tea is an antioxidant. So you can drink chai tea and things like that. You know, it's all good for you. Whereas soda, no. Okay. Right, I think that kind of addresses today's video. So thank you ever so much for listening. Thank you for tuning in. I hope you've got something out of that. If you have any questions, please post them on the YouTube channel and we will answer them. If you want to learn more about me and what I do, then you can Google my name, or you can go to our website, which is drdanielnightingale.com. Please share this YouTube video with friends, with family, with colleagues, with anybody that is within your circle of life, because the more people we educate, the better. The more people we can get on board with reducing the risks of neurodegenerative disease and disorders, the better. And I want you all to have a very healthy and a very long life span. So take care. I will see you all next week, and we'll be posting the topic in a few days. So be safe.